trastuzumab deruxtecan in HER2. What an amazing drug. And you know, it's so funny. I was talking to one of my patients one day, telling them that this drug is so big and so important that there is a new era now. There is the era of after T-DXd and the era before T-DXd.
I think like we are aligned for sure about this, and I will add, there's also in my personal and professional life a pre and post T-DXd era, because I think what really made me jump into this ADC field, made me interested about all this, was seeing some of the first responses with T-DXd in DESTINY-Breast01, the phase 2 trial in HER2 positive breast cancer. So we had it open in Milan, Italy, when I was still there in training, and I was lucky enough to get assigned to it, you know, oversee it, to follow every patient on it. And I was so surprised and positively surprised that every patient with highly pretreated HER2 positive metastatic breast cancer, patients for which basically nothing really worked that well, every patient would respond, and not respond for a little while. Patients would respond for 1 year, 1.5 years, 2 years, and that was like remarkable, and that made me think something is happening here, and I need to study what's happening. I need to be there.
Talk to me a little bit about the DESTINY-Breast03.
So yeah, DESTINY-Breast03 was this phase 3 trial that compared T-DXd to the prior second-line treatment in HER2 positive metastatic breast cancer, that was T-DM1. And T-DM1 was is still an amazing drug, I feel, because it's usually very well tolerated. It's an infusion you give every 3 weeks, and for about 30% of the patients it works pretty well, as a nice response rate. But in truth, T-DXd was supposed to be the better T-DM1. Compared to T-DM1, T-DXd has got a higher drug-to-antibody ratio, so 8 molecules of chemo per each trastuzumab, and a cleavable linker that leads to a bystander effect. And so on the paper, it was supposed to be better. I don't think we were expecting it to be so much better. And so in terms of progression-free survival, T-DXd has 4-fold improvement in progression-free survival. T-DM1 was associated with about 7-month PFS, which is what you would expect in this second-line HER2 positive metastatic breast cancer. T-DXd at 29 months, more than 2 years on a median. And so like, that kind of changed practice on the exact moment where Javier Cortez presented it. And many felt like that would have deserved a standing ovation, but it was during COVID. So it was presented half virtually, and so they had to wait a little bit, we had to wait a little bit more before we saw a standing ovation with T-DXd, but we ended up seeing that.